Practice Green Health Program and their Healthy Hospital Initiatives. Excuse me, something happened there. Sorry there. Go back to the slideshow. Let me just advance back. I don't know what happened there. Cecilia, you still see me, don't you?
I see, but I see a weird bar at the top of your slides, like a
Yeah, I
gray
can't
bar.
get rid of that. I don't know.
Okay.
Yeah, that's what
No
I was
worries.
trying to get rid of before. Anybody know how to get rid of that?
I think it's okay. We can see the majority of your slides.
Yeah. Let me go back. So, and the American Hospital Association has an excellent sustainability roadmap. And these are resources on eliminating solid waste incinerators, eliminating mercury devices, improving the uses of energy and using renewable energy by big hospital systems, working on their waste management, reuse, recycling, packaging and plastics, greening the hospital supply chain, working on the release of climate warming anesthetic gases by operating rooms, working on transportation choices for the staff, climate advocacy, and food choices, providing healthier foods in the cafeterias and on the tray at the bedside. And if your hospital doesn't have a sustainability program, please speak to your administrator, have them join Healthcare Without Harm or the American Hospital Association or another organization, but I'm particularly fond of Healthcare Without Harm's programs to provide great guidance on all these topics. So talk to your hospital administrator, make sure that they're on board. And if they have a sustainability committee, join it. You'll have a lot of fun and meet some neat people. The resources for practice managers and professionals in our offices are more limited. I'm a great fan of the Royal College of Surgeons and Greener Practices, Green Impact for Health. And Dr. Smith is going to be talking to us about this in a few minutes, and I'm really excited about hearing from her. There's a new service called Nurses Drawdown, specific modules that nurses can bring to their practices. The American College of Physicians has a free climate change toolkit. You don't need to be a member to access it, with handouts that you can give to your doctors and to your patients in the waiting room. And finally, the My Green Doctor program, which I'm going to talk about for the next few minutes, which is available on two websites, mygreendoctor.org in English and mygreendoctor.es in Espanol. So what is My Green Doctor? This is a comprehensive, free environmental sustainability practice management program for healthcare offices. We're about helping practices manage themselves better. Our program is evidence-based. It's written by health professionals with more than 450 pages of content. It's quite comprehensive, although we've structured it so that most people never need to read most of that material. My Green Doctor is suitable for any outpatient clinic, office, or facility. No study or science background is needed. We have more than 800 registered offices in 62 countries, actually, and we're adding about 2 to 3 offices every day that register to use My Green Doctor. And we've been shown to save practice money. One 5-clinic group in Florida is saving about $1,500 US per year per doctor. And they've done amazing things with the money over the last couple of years. They bought solar panels for one of their big buildings 2 years ago, which was really fun. Now we go forward. Okay. These are the 23 participating organizations that share My Green Doctor with their members as a free membership benefit. I encourage you to consider asking your professional society to offer My Green Doctor for free. We don't charge the medical societies or their members to use this resource, and most physicians save about $450 the first year by taking advantage of this resource. When people register, they get a free My Green Doctor office pledge certificate, which is available in any language. We sent it out in 14 languages so far. And we encourage nurses and doctors to print this and get an inexpensive frame, hang it in the waiting room, hang it in the break room to really brag about their pledge to go green. Make it a public statement. We also have something called the Meeting by Meeting Guide, a very simple, straightforward guide where we ask offices to add 5 minutes of My Green Doctor to each regular practice planning meeting. So if your office meets once a week to talk about business issues like the schedule or complaints or whatever, or maybe you meet once a month, or maybe you practice huddles. Everyone gets together in huddles each morning. We ask you to have 5 minutes once a week or once a month to those sessions. To make it easy, each of those 5-minute My Green Doctor sessions is fully scripted. So there's nothing to plan in advance. Everything that you're going to say and do is given to you in advance. We focus on slow, steady improvements. We emphasize patient and staff teaching, and we try to involve every member of the healthcare practice, not just a few interested people, but everyone in the practice to be involved. And finally, we provide a green team notes form for easy record keeping. How about green teams? I'm actually opposed to green teams. And because every green team that I've worked with over the past 12 years of My Green Doctor has failed. So a green team is when you try to find 2 or 3 people who work in your clinic, and you're going to meet for lunch once a month to work on a few sustainability topics or a few climate change topics. What happens is they always fail because it's a small group, 2 or 3 people, and someone can't attend, someone's on vacation, and it peters out. I'm opposed to green teams. I really encourage it that sustainability become a core value of the whole practice, and that My Green Doctor becomes part of the whole practice meeting, not just segregating a small group of people. That's how you create a sustainable environmental sustainability program. So no green teams. Make sustainability something that everyone in the practice does. These are some of the solutions that are offered by My Green Doctor, some of the more than 120 topics that we provide. We encourage practices to analyze their carbon footprint, to improve their use of appliances with Energy Star or similar energy efficient devices. We encourage safer choices of chemicals in the workplace, cleaning products, etc. We encourage recycling to avoid styrofoam and other non-reusable materials. We emphasize healthy foods, healthy for the staff, healthy for the patients, healthy for the environment. We have abundant teaching materials, brochures, posters, and other materials, really dozens and dozens of teaching tips for the practice. And we have the pledge certificate that we encourage practices to print out when we send it to them after registering, put it up on that waiting room wall in the break room, and brag about your pledge to go green. These are some of our Your Healthy Home brochures that are available on the website in English and in Spanish, and they really are state-of-the-art brochures for patients to take home, sit on the kitchen table, and think about over a couple of weeks. This is our Green Doctor Office Recognition Certificate that goes to offices that meet the criteria that we set out for them, and you can read about the criteria for receiving this. It's normally $250 every 3 years, but it's free for members of participating organizations. You can see Dave Ivinson on the left is very proud of one of his accomplishments in the office. They put up a bulletin board to talk about, talk to each other, talk about the staff about their green practices. Dave's Ivinson Dermatology was awarded the Green Doctor Certificate 5 or 6 years ago. So what I really want to talk about is getting you started. So that's what we're going to do in these last 2 or 3 slides. And I'm going to begin with a video. I hope it works. You're the first to see this video because it was just finished by a filmmaker a couple of days ago. It's 3 minutes, and it's going to tell you how we get started. Let's see if it's going to
welcome to My Green Doctor.
Can you hear it?
In this 3-minute video, I'll be showing you how your office can easily save
You
money,
can hear it.
create a healthier community, and even a healthier planet, all by going green. Step 1 is to register at either of our websites, mygreendoctor.org or mygreendoctor.es. Sí, en español también. Step 2 is to talk about this in the medical office, clinic, or outpatient center. Ask your leadership team to agree to make sustainability something important that your office does, and that you'll stick with it. Step 3 is to add My Green Doctor to the agenda of each office planning meeting. Okay, step 4. Let's start. Under the Green Team Guide tab, click on the Meeting by Meeting Guide. Here, you can find pre-made scripts that make each meeting a breeze. You'll also find the Green Team Notes form where you can record your progress. At your meetings, you'll read the meeting by meeting script together, discuss ideas, make a decision or two, and just like that, you're done. Collaborate, make it fun, make a difference together. Oh, and announce the date for your next 5 minutes of My Green Doctor. So what's in these scripts anyway? In the first week, you'll introduce My Green Doctor to your team and begin your journey by reading 10 reasons to go green. Weeks 2 and 3 are where the savings begin. One My Green Doctor practice is saving $14,000 every year. That's a lot of green. They installed energy-efficient light bulbs, adjusted thermostats, turned off devices at night, and even shut off the hot water heater. We'll show you easy ways to reduce your impact on the environment and save money fast. Next, weeks 4 and 5, recycling. Reduce, reuse, recycle is the mantra. We'll explain how. Week 6 is where you can really make a difference by educating patients on the same topics you've been studying and more. This guide also discusses extreme heat, storm damage, fires, other risks, and how patients can protect their families. In weeks 7 and 8, you'll work on proper disposal, green cleaning, and safer chemicals. Week 9 is healthy foods. Healthy for your patients, healthy for the planet. And don't forget to fill out your Green Team Notes forms. After 5 meetings, email us photos or scans of your notes forms and we'll send you this gorgeous Green Doctor Office certificate to display to tell the world about your success. Here's your last step. Keep going. And don't worry if you get past week 9. After that, we have more than a year of ideas for you and additional resources once you pass that point. Okay, to recap. Register My Green Doctor, talk with management about committing to sustainability and saving money, put 5 minutes of My Green Doctor on every agenda, earn that Green Doctor Office certificate, and keep going. Well, my time's up. Gotta go. Thanks for going green.
All right. Let's see if I can get to the last slide. We've already talked about that. Oh, this is my last slide. So just to recap, greening your office, 6 steps, register My Green Doctor, and I've listed here a discount code. If you register as a Partner Society member and use the discount code MGD Welcome, you'll waive the $60 a year registration fee forever, and you'll get full access to My Green Doctor at no charge forever. So register My Green Doctor MGD Welcome. Adopt sustainability as a core value and brag about it by putting up that Green Doctor Office Pledge Certificate. Make a commitment to adding 5 minutes of My Green Doctor, just 5 minutes, to each practice meeting. Make small, steady improvements in your organization. Don't try to rush it. If you do more, you're going to wear everybody out. Provide patients with brochures, posters, and other teaching tips, and commit to qualifying for that Green Doctor Office certificate. So this is my last slide. I want to thank the Caribbean Institute for Meteorology and Hydrology, EarthMedic and Earth Nurse, and the Global Consortium on Climate Change and Health for this remarkable multi-week symposium. And I want to thank you for going green today.
Thank you so much, Dr. Sack. You have done so much incredible leadership in this field in terms of really showing clinicians how they can take matters into their own hands, into their own clinics, and really change the way we practice medicine. And it's so cool. And obviously, as you said, it's not hard. This isn't rocket science. This just takes some leadership, and it takes getting a team together and getting everyone on the same page. So thank you so much for sharing that. And I did put the discount code in the chat. Thank you for that. All our participants, I'm sure, will be happy for that. And I will now turn it over to Dr. Honey Smith. Honey, thank you so much for being here today. Dr. Honey Smith is a general practitioner from the UK, and she is working with an incredible organization called Greener Practice. So Honey, I'll let you take it away.
I'm so sorry about messing up the time difference. I was convinced it was in another hour, so I would have missed the whole thing. So I'm so sorry for giving everybody a fright. That was fantastic, Todd. Thank you so much. And actually dovetails really well with what I want to talk about today. So let me just see if I can share my let's see. Have I done that right?
It looks great. We can see your screen.
Yeah. Oh,
Yep.
okay, right. I just need to go back one. Okay, so I, as Cecilia very kindly said, I'm the co-chair of an organisation called Greener Practice, which formed about 5 years ago. So just to give you a little bit of background about greener practice, it started in 2017 as a result of a conversation in a pub between my colleague Artie Bansal, who was the founder, and another of my colleagues, Amar Raghani, both GPs in Sheffield. And Amar's question to Artie was, how do we get GPs on board in this country, you know, on doing something about climate change? And greener practice was set up as a result of that conversation. And I came on board very, very early on with it and got involved. And as a consequence of greener practice forming, we put forward a motion to the Royal College of GPs to ask them to declare a climate emergency, which they did in 2019. And initially, greener practice started in South Yorkshire, where we're all GPs. And after that, we really sort of started to develop new organisations. So a group set up in London, Brighton and Glasgow in 2020. Later that year, we developed these special interest groups, which were basically around certain aspects of greening our practice to get people involved in the conversation. And those kind of really went bananas actually very quickly. Extremely busy networks where people discuss changes they want to make in their practice and changes at a national level. So that was really exciting. In 2021, we became a community interest company, and that was really so that we could work with the NHS in the UK and big organisations to really make a difference and partner with them. And by the end of 2021, we got 25 groups around the country from the start of just one group in Sheffield, in South Yorkshire. So that for me was massively exciting because the conversation is just blossoming in the UK. And we've got interesting groups starting around the world as well, which is incredibly exciting. So I just wanted to give you a little bit of background, and those are how our logos developed through the years. We've just relaunched our website with a new logo. So we're basically a network. That's essentially what we are. But we have a website which is a one-stop shop for people to find the resources, GPs and other primary care health professionals, to find all the information that they might need to green their practice. We're also involved at high-level conversations with the NHS and Greener NHS in taking action and having conversations with them. We're, as I say, establishing local groups. We have a national voice. We're creating partnerships with other organisations. So obviously this is something that Todd's covered a little bit. I think one of the things I want to say is that going green, the health crisis, the climate crisis is a health crisis, is a threat. It's a massive threat. It's the biggest threat we've ever faced. It's also an enormous opportunity if we turn this on its head. We have the opportunity to move from that ghastly picture on the left of this slide with obesity, lack of physical activity, air pollution, all sorts of horrors that are facing us in terms of epidemics, to a different sort of future where we're eating sustainable diets, we're getting on our bicycles and walking, engaging with active travel, reducing air pollution, using green spaces effectively and engaging with nature. You know, we have a choice here. We don't have very long to make the choice, but we have a choice. And the solutions that we need to solve the climate crisis are the same solutions that we need to solve obesity, air pollution, inactivity, all the other sort of ills that are facing us, really, or many of the other ills that are facing us. And I just want to touch on this issue of planetary boundaries because you may or may not be aware that the UK, the NHS has committed to net zero in carbon emissions by 2040 in its direct emissions and 2045 in its indirect emissions. And that's everything in the supply chain. And so there's a real temptation that we really only think about carbon in terms of what we need to do. But there are other planetary boundaries that I know you're going to touch on you're going to deal with in your course. So I'm not going to spend any time talking about those, but I do want to set it in the context that this is not just about net zero. This is also about air quality, water supply and quality, land usage and soil quality, biodiversity and ocean health, and all the things we're talking about will either not affect those in a bad way or would likely affect those in a good way, all the changes that we want to make. So I'm going to concentrate on looking at things in terms of where the hotspots are in general practice in primary care, because that's my sphere of influence and my sphere of interest. my sphere of interest. And the main carbon hotspots, as you'll see from the slide, are in our prescribing. They're from pharmaceuticals, both inhalers and excluding inhalers. Those are the two big places where we can really make a difference. So just looking at the slide, I'm sorry about the quality of the slide, but just looking at this slide, you know, there are other areas that we might look at, but in terms of the non-clinical carbon, but the majority of our carbon footprint comes from our clinical care, and that's really where I want to focus our talk today, because Todd's very helpfully talked about a lot of the other areas, and I want to concentrate on the clinical realm. So in the UK, the place where I go to for my non-clinical decarbonisation information is an organisation called SEE Sustainability, run by a colleague of mine called Matt Sawyer, who has a fantastic website, and I would encourage you to look at that as well as looking at Todd's amazing programme, because there's a lot of resources on there that will help you in the non-clinical areas of your decarbonisation. But we're really focusing mainly today on the clinical side of things. So the principles of sustainable clinical practice that were created by the Centre for Sustainable Healthcare by my colleague, Dr. Frances Mortimer, are disease prevention and health promotion. The most carbon efficient disease is the one that doesn't happen at all. So if we can prevent disease, and better still promote health, which is a different thing, an even more holistic thing really to promote health, we're actually preventing a lot of carbon use in the NHS and in our healthcare. We're also talking about patient education and empowerment, because the more patients take control of their own illness, the less likely they are to need to use our resources. And so that's a far more carbon efficient way and better for patients as well if they're managing their own disease. Looking at lean service delivery, so that's basically smoothing out the process of how we look after patients, so that we're not duplicating, we're not doing unnecessary healthcare, we're making our delivery of care most efficient and most effective. And then the last of those four principles is low carbon healthcare options, such as switching to dry powder inhalers, which I'll talk about a little bit, or using reusable instruments and so on. So those are the four principles of clinical practice, of sustainability in clinical practice. So the most impactful things that we can do in the clinical realm are around high quality, low carbon asthma care, which I'll come into in a moment. It's about reducing our medication prescribing, because that huge burden is in medication prescribing. It's about reducing overdiagnosis and over-investigation. It's about streamlining care, and it's about low carbon alternatives. I'm so sorry about the quality of the slide, but the reason we want to focus on asthma care particularly is because those metered dose inhalers at the top of that slide are very carbon intensive. They have a carbon footprint that's 40 times that of their dry powder inhaler counterparts, shown lower in the slide. So every time we use a metered dose inhaler, it's like driving 175 miles in a fossil fuel car, as opposed to 4 miles if we use a dry powder inhaler. So this is a really important focus of our decarbonisation activities. So low carbon, excellent asthma care. Fortunately, there's no conflict between low carbon care and excellent asthma care. They are fortunately the same thing. So the main thing we need to be focusing on is reducing our short-acting beta agonist over-reliance. So helping patients to have good control of the inflammation in their airways by using inhaled corticosteroids and all the other things that we do to reduce SABA over-reliance. It's about looking at inhaler technique. It's about using personalised asthma action plans, which is part of patient empowerment, helping patients to manage their asthma well. And then it's about looking at inhaler type. I'm not going to go into any detail in this because we haven't got time today, but I would encourage you to look at, on our Greener Practice website, there's a fantastic document called How to Reduce the Carbon Footprint of Inhaler Prescribing, written by Artie Bansal and a couple of other colleagues. And there's also an asthma QI toolkit, which you can work through to look at asthma care in a lot more detail. And there are fantastic projects that you can do based on the toolkit to reduce the carbon footprint of our asthma care. So reducing medication prescribing, evidence-based disease prevention is what we do best in general practice. It's what we focus on most. That's a very useful place to start because, as I say, the diseases that don't happen are the diseases that are most carbon efficient, such as preventing diabetes, preventing ill health from high blood pressure, all of those kind of things that we can do to reduce ill health in the first place. Supporting healthy living. And we've moved away from the term lifestyle medicine because it's become a slightly tainted term. It implies that it's people's fault that they're ill because of their lifestyle. We'd rather talk about healthy living because the reasons why people have poor lifestyle are often well beyond their control. But we can actually encourage people to engage in active travel, to improve their diets, to reduce their stress, and use things like green prescribing, things like engagement with nature, exercise in nature, and so on. Structured medication reviews and deprescribing are a fantastically useful level of focus, which I'm going to talk about in a moment. And finally, reducing medicines wastage is another area where we can, a wasted medicine is no use to anybody. And in the UK, it's estimated that we waste about £300 million of medication each year. So if we can do anything to reduce that, that's both money and carbon that we're saving. So this is a project that I did in my own practice, which we advocate in Greener Practice, which is around reducing the anticholinergic burden of drugs. So anticholinergic burden is associated with a number of significant adverse effects, such as falls, cognitive decline, and increased mortality. And so it's hugely helpful if we can reduce the anticholinergic burden of our drugs. And it's a really useful focus for decarbonisation as well, because so many drugs have a high anticholinergic burden. So we can, in one fell swoop, reduce our carbon burden and the danger to our patients. So patients with an ACB score of over 3 are considered to be high risk patients. So what we did in our practice was we did an audit of this and discovered we really weren't very good at looking at anticholinergic burden. So what we now do is we ask our pharmacy technician to do an ACB score on patients who are on 10 or more medications. We ask the pharmacy technician to highlight any patients with a score of over 3 or 3 or more. And we ask the doctor or pharmacist to discuss the risk with patients and explore a plan to reduce medication as appropriate with the patient. And honestly, I can tell you there is nothing more guaranteed to focus minds on reducing medication than telling patients the dangers of these drugs. And there's an IT tool in development for our IT systems so that this is done automatically and is highlighted automatically. And that's provided a very useful focus for deprescribing. Another project that's underway in the UK is a project run by my colleague, Dr. Deb Gompertz, called Show Me Your Meds, Please. Now, this is a pilot project identifying around 40 patients in the Somerset area of England. And as a result of her plan, 39 medications amongst those patients were stopped. There were 35 new diagnoses of cognitive impairment. So what they were doing was they were going into patients' homes, looking in their cupboards and seeing how many medications they had stored in their cupboards. And this is what you'll recognise this picture. I'm sure any of you who are primary care physicians, opening the cupboards and seeing huge stockpiles of medication that patients weren't taking. And cognitive impairment was very common amongst these patients. The project with those 40 patients saved over 1,500 kilograms of CO2 and over £3,500. And there was massive ongoing waste prevented. And we can't even measure, how many falls were prevented by stopping these medications that were actually useless, how many, potential medication overdoses because of patients taking medication incorrectly through not understanding how they should be taking them. So there were huge ongoing benefits. Oh, sorry, got a bit of disturbance there. So reducing overdiagnosis and overinvestigation, there are lots of websites we can use. There's one called Choosing Wisely, which is really useful for helping to focus our discussions around overdiagnosis and overinvestigation. The Royal College of GPs has an overdiagnosis group. Atul Gawande wrote a wonderful book called Being Mortal, which focus on what matters to you conversations. And there's a website on what matters to you, which can help you to look at how to reduce overdiagnosis and over-investigation. And advanced care planning with patients is a really useful area of focus to help us plan our conversations around when patients no longer want over investigation, no longer want us to be doing as much as we would do with perhaps younger patients. Streamlining care, remote consulting happened around the pandemic, and that will have a major ongoing effect in terms of reducing the carbon footprint of our care, bringing our care closer to home, effective use of IT, holistic and patient-centered approaches. And you might want to make streamlining care a focus of a sustainable quality improvement project. So looking at low carbon alternatives, we've talked a little bit about dry powder inhalers as first line where possible. Perhaps trying reusable PPE. There are a lot of projects going on in the UK to help us to use reusable PPE rather than disposable. I've started a project in my own practice using reusable surgical instruments for coils. We used to use metal instruments that were disposable, and we're now using reusable surgical instruments which have a much lower carbon footprint. And the Sharp Smart, sorry about that back to front picture, Sharp Smart have refillable Sharps bins, which massively reduce the carbon impact of throwing away our Sharps. So you might want to think about a sustainable quality improvement project. This really looks at the social, environmental and financial impact of our interventions. And a sustainable quality impact principle can be applied to any quality improvement project that you do. And there's a fantastic website called SUSQUI, which looks at that and gives you a step-by-step guide how to do a sustainable quality improvement project. And there are plenty of examples of that on the Greener Practice website, including on the Asthma Toolkit. So when you've done that, share the learning, because other people might be able to use that project without having to reinvent the wheel every time we look at these things. The other thing I'd suggest is forming a group. It's a really powerful way to support each other. So the groups that we have around the country meet usually about once every 6 weeks. This was also one of our very first meetings before COVID made us do it all online. We share ideas, resources and local initiatives, and it gives us an economy of scale. It means that we can lobby and work at a higher level to make a difference in our organisations. And we work collaboratively, I can't say it, with other agencies to make changes. So Todd mentioned the Green Impact for Health Toolkit, and I haven't gone into that, but if you go to the Greener Practice website, the Green Impact for Health Kit is not administered by us, it's administered by the Royal College of GPs, but it's free for all GPs in the UK to use, and I'm sure there'd be absolutely no problem with people registering for it elsewhere. And it covers pretty much all the aspects of decarbonisation in your practice that you might want to consider. And as I say, it's free to use, so you're more than welcome to do that. The organisation asks for a £25 voluntary donation, but it is actually free if people don't want to pay that. And it's a very useful area a very useful website to cover all the areas of decarbonisation that you might want to consider. So do follow us on Twitter. And if you want to email me on Greener Practice, I will answer any emails giving you as much information as I can about what we're doing in the UK and how you can use that sort of information and decarbonisation advice in the Caribbean. So that's all I've got to say today. It was a whistle-stop tour, but I hope that has been helpful.
Thank you so much, Dr. Smith. And I'll ask you to stop sharing your screen for a minute. Perfect. Wonderful. Well, we have some great questions from the chat, and you two are both doing so much in this space. You're really leading the cutting edge, and so we're grateful to have you here today. So our first question is from Kelva Joseph Phillip, and the question is, how can an employee who is not in a managerial position encourage his or her organization to go green or to implement measures? And maybe we'll hear a little bit from both of you on how we can do that.
Honey, go ahead.
Well, I think keep saying it. I mean, we found, so what's happened in the UK is that partly as a result of the net zero declaration by the NHS, we're now all being asked to, trusts are being asked to write their green plans. That hasn't had a very strong primary care voice. That's been mainly in hospitals, hospital trusts. But actually, my colleagues in greener practice just keep on pestering and pestering and pestering and making a real nuisance of themselves. And what's actually happened is that quite a few of those people are now in paid roles because they've made their voices heard. And eventually paid roles have come up to do that decarbonisation work. But yeah, make a nuisance of yourself. I think that would be the best advice I could give you.
So I had three answers to that. One is, take a look at the website, register, and look at the 10 reasons to go green. Take those 10 reasons to the leader of your unit, whether it's the ward clerk or the manager or the lead physician, and tell them, hey, read them the first one. They're going to save money. Because for health professionals or managers, if you can save the money, you're going to get their attention. And then tell them, we're only asking you to add 5 minutes of My Green Doctor at each of our planning meetings. And I think you'll have a chance of getting started. You could also offer to lead those 5-minute sessions. Everything's scripted, so there's really nothing for you to study. You don't need to become a sustainability expert or a tree hugger. Yeah, gosh, I'm thrilled you asked the question because you're clearly the leader who's going to make it happen in your unit, and that's wonderful.
Thank you so much, both of you. This question is for Dr. Sack. And the question is, what global monitoring benchmarks are used for My Green Doctor? How do you align what you're doing with other initiatives for benchmarking? And maybe Honey, be interested to hear sort of how you think about sort of global benchmarks and how we work towards them.
So 12 years ago, when we launched My Green Doctor, we asked offices to register and to quantitate what they were accomplishing. How many pounds of recycling did you do, or how much did you save on your electric bill every month, and water and use of chemicals and on and on. And nobody did it. Well, one office did, but people are just too busy. They're busy with being great nurses and doctors and HIPAA compliance in the US and all the things we have to do. So we dumbed down the product, honestly. We only asked for 5 minutes and we stopped asking them to quantitate. Instead, we asked them to have a sustainable, long-term sustainability program that becomes part of the core value of that office, of that practice. And we believe that will have an impact. I also believe the greater impact is how we talk to our patients, influence them. We can't quantitate how much they save at home, but we as nurses and doctors can make a difference by influencing the choices of our patients. So we're not quantitative, I apologize, but go ahead and get started, and I think you can make a difference.
That's a great answer, Todd. And, I think for those of us who run small clinics, yeah, that's too much. But maybe when it comes to level of health systems, maybe that's where there's some infrastructure for benchmarking and monitoring, and we'll be hearing more about that later in the course. But I agree with you. We've got to make it easy for people to do this, so we at least get people involved and get them learning. Honey, what's your experience with this?
Oh, you're muted.
Yeah, I mean, I think I agree with Todd. I think what the main key to this is to make it as easy as possible for people to do it. I don't think I've got any information on benchmarking at the moment. I think we're too early in that conversation, really. But I think you're right. I think the main thing is just to make it as easy as possible. And I love the idea of your, scripted responses. I think that's really useful. I think that's an idea that I might kind of take back for us in the UK, actually, because it's not something we've looked at very much. I think the Green Impact for Health Toolkit, the idea is to make it as simple as possible. And so the idea of that is that people can tick off actions that they take and work towards awards. So they work towards bronze, silver, or green or carbon award. There's nothing attached to that. It's just, as you say, it's bragging rights, really. So that I would agree. I think it's about making it as simple and straightforward as possible.
Thank you both so much. And anyone can put any questions they have for our speakers in the chat. Our next question is, both of you have talked a lot about, talking to patients about this. And, it's interesting, Honey, especially with your examples of how it actually can be better for their health to come off these medications. And I know a lot of patients want to do that. And so I'm just curious to hear, how do you approach this with patients? It seems like it might be a little tricky. So I'm curious to see how both of you get it in there.
So I guess the main thing that I would talk to them about would be in terms of inhalers. We always start from the point of view of what's best for them individually as patients, and I would never suggest that, for example, we never do mass switches of dry powder inhalers. That would be, dangerous really, and we would never do that. But actually, every time I've raised this with a patient about actually what's best for their asthma care, fortunately, dry powder inhalers are much easier to use than metered dose inhalers. So there's really no conflict between green care and excellent asthma care. But actually, I tend to throw into the conversation, and it's better for the environment. And I've yet to have a patient who's objected to that. I mean, most patients say, I'd love to do something for the environment. So actually, patients understand this is really important, especially when we tell them that, for asthma patients particularly, it's so important that we deal with the climate crisis. The other area that I think can be really fruitful is air pollution, to talk to patients about, because actually patients understand that it's really tangible that air pollution, that they're particularly people living in deprived areas and in cities. So those are the two areas that I tend to bring it into the conversation. And also about, we've got a garden in my practice, we've set up a community garden, so that patients can come and do some community gardening and grow vegetables and so on. It's in its very embryo stages, but actually explaining to them about exercise in nature and how good that is for them to reconnect with nature, how much better it is for them to exercise outdoors than going to the gym, and throwing into the conversation as well about how that engages them better with the natural world. So there's lots of opportunities for getting this into conversations with patients, actually.
Thank you, Honey. Todd, any thoughts on this?
Well, I just want to salute what Honey and her colleagues are doing in the UK. They really introduced this concept of decarbonization, and we should all take it seriously and follow their work. It's really quite important. That's going to be the mantra for this decade, to decarbonize our industry.
Yeah, thank you both so much. We have a question from Asthma Dundee. Asma, sorry if I said your name wrong. So her question is about medical waste. We know those biohazard boxes take, I don't know, something like 6 to 10 times more energy to dispose of. We're wondering if you have any strategies for how to reduce that type of waste.
Todd, do you want to go first?
Well, it's about week 8 in My Green Doctor, so I encourage you to get started, do the low-lying hanging fruit first, and then get to medical waste, which is tough. It's about what we purchase first of all. Can we purchase reusable items first? Can we avoid purchasing things completely? Are we overprotecting ourselves with too much personal protective gear and too many gloves and too many this and that? I'm a gastroenterologist. I work in liver disease and all sorts of dirty things. We just overprotect ourselves. And so there's that aspect. It's complicated, and it takes a team approach in the practice and a dedicated amount of time. But, get your sustainability project going and then address waste once you have a commitment by your organization. You can get there. And by the way, save a lot of money by avoiding all the unnecessary products, and it's ridiculous how much we waste.
Yeah, no, I absolutely, it is completely ridiculous. I think that's absolutely right. So we're looking at using reusable masks. There's an organization, there's a company called Revolution Zero who make reusable type 2R masks, which are ideal for use in general practice. It's not a high risk environment. It's no more dangerous than going to a hairdresser's. So we've now abandoned using gloves and aprons for everything except splash procedures where we would have worn them before. So before the pandemic, there was a campaign from Great Ormond Street called the Gloves Off campaign, and they actually showed that contamination was more likely if you were using gloves because people forgot how to wash their hands properly. So they were very strongly saying, don't use gloves unless it's a splash procedure or an intimate procedure. And I've I've gone back to that. Really, that's so I'm not using gloves or aprons anymore, and that is actually in line with UK practice now, which has been a bit slow to change after the pandemic, but it has come back to that. So I think not using in the first place, stopping using couch roll is another thing. Why do we use couch roll? It's not necessary unless we're using it, unless again we're doing an intimate procedure. It's really not necessary. So I've stopped using couch roll. We're using reusable instruments for coil fits, as I say, so any and surgical procedures. Using single-use metal instruments or plastic instruments is just a disgrace. It's an abomination, and it has to stop. So that's one of the things that we've been doing. The other thing is about things like segregation of waste. So in the UK, so far, in hospitals, they have segregation of waste between offensive waste and infectious waste. So that offensive waste is disposed of at a lower temperature than infectious waste, but in general practice we haven't had that yet. So we've been waiting for these special bins for 12 years now, and we think they might finally be coming. So segregation of waste is really important because you can dispose of waste at a lower level if it's segregated properly. But I think it comes back to those principles of sustainable healthcare, that the more we're preventing disease, the more we're empowering patients, the less healthcare activity is going on, and therefore the less we will generate waste. So those are the basic, I would say, those are the two most important principles. And of course, streamlining care will also come into that framework as well.
I want to add one last comment. So close to waste is the concept of cleaning. 3 comments. One, let's be careful not to adopt our current COVID precautions and make them permanently part of our healthcare system. In early 2020, we didn't know how to protect ourselves against COVID. We now know that we probably overdid it in every setting except the ICU. Let's not let those COVID precautions become the standard. Let's move back to what was the standard of practice before, where we use much less. Second, be cautious about bleach. The profession most likely to get asthma are nurses because of the excess and unnecessary uses of bleach to disinfect when that's not necessary. So get bleach out of your world, and don't disinfect, which is that most aggressive level of cleaning with the most expensive and most dangerous chemicals. Don't disinfect when all we need to do is clean, and we can save money and toxic materials by not disinfecting when it's truly not necessary.
I should qualify that I'm still using gloves for hot cases, because that's in line with UK guidance. Although I totally agree with you, Todd. I think we massively overdid it. I think the evidence supports that, doesn't it?
Thank you both. Another question from the chat: how can we incorporate a green lens and sustainability into a mental health or a psychology practice?
Well, if it's an outpatient clinic, go to My Green Doctor and just do it. It's the template is there. Get started tomorrow.
Yeah, and I think in terms of in general, obviously we in general practice we tend to see the lower the less intense sort of psychiatric stroke psychological work. But I think one of the most important things we can do is things like green and blue prescribing. We know that engagement with nature, and particularly engagement with water, natural spaces around water, is really, really good for mental health. It's actually very good for physical health as well, because it improves our immune system. But the mental health benefits of engagement with nature are enormous. And so that's one of the things I would say is a really important aspect of greening our psychological and psychiatric care. I think there's also a lot of things about how we view antidepressants, for example, that there are, I'm sure everybody's aware that, things like CBT are just as effective as antidepressants. We don't always need to leap to drug treatments, but also around stopping antidepressants. So, the risk of relapse when we stop antidepressants is about 30% sorry, 40% of patients relapse, but 30% will relapse if we don't stop antidepressants. So there's really no advantage in keeping them going long term. And using things like CBT at the time of reducing antidepressants actually reduces that relapse rate. So, you know, I think we should really be thinking in terms of de-prescribing as well as green and blue prescribing for psychological care. And things like, you know, gardening. We know gardening is good for mental health. So using our spaces, that's one of the things we're looking at a lot in the UK, is using the healthcare spaces. So spaces in hospital where you could grow vegetables, engage people. I mean, it's very much like the old psychiatric hospitals, bizarrely, in the UK, where people did their therapeutic gardening. We're sort of going back to that, actually, because using green spaces in GP practices and in healthcare settings, there's a huge sort of repository of green space that we could use for therapeutic purposes and improve the biodiversity of our estate at the same time.
Thank you both so much. And one more question from the chat, which is, how can environmental scientists and environmental health professionals help or support this effort?
I have two answers to that. Environmental scientists are really doing wonderful work at looking at the climate impact, the greenhouse gas impact of our practices. And in the long term, that's going to have a huge impact to leading the policymakers to force us to go green. So we need those studies to be done to understand how much carbon dioxide is really coming out of every facet of inpatient practices and outpatient practice. Second is, if your own office doesn't have a sustainability unit, start one. Dr. Smith's and my services are both applicable to any office, truly. So just do it. And finally, ask your doctor to go green. They can use My Green Doctor, and they can use greener practice. So, you know, encourage them to pick up these tools, and they can save money. And so talk to your doctor.
Yeah, absolutely. I mean, I think environmental scientists can be massively helpful. I mean, there's been a lot of really useful work coming out of, you know, looking at the planetary boundaries, not just, as I was saying earlier, not just about carbon, but also about air pollution, about water quality, about soil quality, land usage, and so on, and mapping those things. I've seen some fantastic pieces of work where people have mapped how different food substances, for example, will map onto all those different planetary boundaries. So, for example, you know, a low meat, high vegetable diet, you know, a plant-based diet or plant-forward diet is considered to be much better for the environment. But there are certain parts of that actually we need to be very careful of, like avocados, because they're actually not very sustainable at all. You know, almonds, for example, you know, we need to look in more detail at some of this stuff to really make sure we're making good choices. And environmental scientists are incredibly useful in doing that, some of that stuff. And also just in the advances in technology, you know, just to, you know, coming up with new solutions to problems such as, I mean, not it's environmental scientists that do this, but you know, the Revolution Zero masks, the Sharp Smart bins, you know, the sort of technological solutions that we need to some of our the problems of consumption in healthcare. You know, the scientific world can come up with an extraordinary number of fantastic solutions to help us with some of those things. So I think it needs to be a really ongoing conversation to make sure that the environmental scientists are very much involved in supporting us in this journey.
Thank you so much, Dr. Smith and Dr. Sack. This has been incredibly interesting and eye-opening to think about all the ways that we can work towards this in our own practices and together, most importantly. So thank you both so much for being here and sharing so much important work that you do. We will be posting both of your presentations on the website as well as the recording of this session. And so hopefully, you know, people can find what they need out of your resources, and we'll follow up with you if we have more questions. So thank you so much. A quick note about the CME link for today. We've just realized that it is the incorrect link. So we will be sending out an announcement about claiming CME for this session. Don't worry, we will make sure that you all get credit for this. So with that, everyone have a wonderful, wonderful rest of your evening. Our next Skills and Practice session is going to be on communication. So please join us for that. And we will see you at the next session, which will be tomorrow. So thank you all and have a wonderful evening. Take care. Bye-bye.
You too.